Today, we are very happy to be joined by Professor Evangelos Liatsikos, Professor of Urology at the University Hospital of Patras in Greece and Chairman of the European School of Urology. Professor Liatsikos, thank you very much for joining us in this podcast and for sharing your experience on partial nephrectomy with us and about complex renal tumors. We would like to ask you some few questions, focusing on some of the key practical take-home messages from your presentation.
Pleasure.
Thank you very much. The first question will be, what makes a renal tumor truly complex for partial nephrectomy?
Well, the renal tumor, the complexity of a procedure has to do with the experience of the surgeon. So what could be complex for me might be easy for you or vice versa. So there are gradings, there is scores about having complexity on tumors, but in very easy words, whatever is very exophytic is easier than whatever is endophytic.
Okay.
Endophytic tumors are more difficult to deal with.
Okay. And in these complex cases, how important it is preoperative imaging and 3D planning for surgical decision-making?
It's imperative. If you want to do a partial nephrectomy, you must study preoperatively your CT scans with a 3D reconstruction. You must know where exactly the tumor is, what is the relationship with the vessels, what is the relationship with the pelvocalyceal system. Otherwise, it makes no sense to proceed like this. An artery has branches. Who are the branches? Which are the branches? Where do they go? You clamp the whole artery, you clamp a branch. All that has to be studied before surgery.
Okay. And how do you decide between off-clamp, selective clamping, or on-clamp ischemia?
Again, this has to do with experience. Normally, if something is very exophytic and very peripheral and small, you can start off clamping, but you always have, at least in the beginning of your experience, you always have to prepare the kidney with the vessels for a potential nephrectomy.
Okay.
So you prepare the vessels, you start off clamp. If you can conclude it off clamp, it's fine. If you don't see well, it's bleeding, you clamp and you proceed. So clamping is not such a, huge part of the operation. You must see when you're doing a partial nephrectomy. When you stop seeing well, you don't do a good partial nephrectomy.
Okay. The tips you will use in a difficult partial nephrectomy.
First of all, you have cleared the vessels. You know exactly which vessel goes where, and you're ready to clamp. You don't clamp though. You start the incision, and when it starts bleeding, then you increase the pressure. You can go up to 20,
okay.
So that will stop venous bleeding. And then you proceed. You clamp and you proceed. It's very important that you actually see well. And it's also very important in endophytic tumors, cystic tumors or whatever, to find the capsule of that tumor. If you manage to go on the capsule and push the capsule of the tumor away from the bed of the kidney, it bleeds less.
Okay. And perhaps most importantly, what intraoperative findings make you decide to convert from partial to a radical nephrectomy?
The only finding that makes you convert to a radical nephrectomy is if you're not sure that you're going to do a safe partial nephrectomy. If you open the tumor and you do a laparoscopic or a radical or a robotic procedure, then the gas spreads the cells and it can be a disaster. So if you're not convinced, or if you are scared that you will open the tumor and you cannot do it, convert to radical nephrectomy. Now, if before the procedure you've considered that your experience is not good enough to conclude that partial nephrectomy, do not plan for a radical nephrectomy before the procedure. Send it to someone that can do a partial nephrectomy. This is a key, especially this is imperative if the patient has only one kidney. If the patient has only one kidney, you need to give it the best chances that you can have for a partial nephrectomy. So send it, if you don't have experience yourself, send it somewhere that have more experience than you have.
Okay. Okay, thank you very much. Thank you for coming and for giving us these tips.
It's a pleasure.
Bye.
Pleasure.
Thank you. Ciao.